Doctors ABCD. The Doctors ABCD Action Plan is the foundation of basic life support, as well as advanced resuscitation, used every time you assess or reassess a sick patient. Danger. Check for any danger to you, the patient, or bystanders, and make the area safe. Response. Check responsiveness using AVPU. Alert. If the patient is clearly awake, they score an A. Voice. Ask loudly, "Hi, I'm a lifeguard. Are you all right?" If they open their eyes, move, or make a sound, they score a V. Pain. If no response, squeeze their shoulder firmly. If they open their eyes, move, or make a sound, they score a P. Unconscious. If there is no response to pain, they score a U. If the patient is unresponsive and not breathing normally, begin CPR. Send for help. Call for an ambulance early or send a helper to call and return with confirmation that help is on the way and how long it will take help to arrive. Airway. Put on your personal protective equipment if available. First, check all unconscious patients for airway obstruction. If solid or obstructing debris can be seen, remove it with your fingers. All adult patients who are unconscious and lying on their back require a head tilt, chin lift. This opens the collapsed soft tissue of the airway. Most drowned patients will produce foam and liquid from their mouth or nose during CPR. Do not ever stop CPR to suction foam or watery liquid. Ignore it and continue ventilations and compressions. Breathing. Look for movement of the chest and abdomen. Listen for breathing. Feel for chest rise. Do not take longer than 10 seconds. If the patient is unresponsive and not breathing normally, start CPR immediately. If there are occasional gasps of breathing, or you are uncertain if they are breathing adequately, begin CPR. It is much safer to start CPR and stop if unnecessary than to delay CPR. Effective ventilations. Mouth-to-mouth and mouth-to-mask ventilations are all very effective methods of rescue breathing. They also pose infection risk to the surf lifeguard and the patient. Surf lifeguards should always carry gloves and a CPR mask while on patrol. To perform expired air ventilation, first ensure the airway is open using head tilt, chin lift, and proper head positioning. Then, seal the patient's nose by pinching the nostrils closed. Take a normal breath in, make an airtight seal on the ventilation-sealed rescue mask or the patient's lips. Deliver each breath steadily over 1 second. Ensure visible rise of the chest with each breath. A lack of chest rise suggests a poor seal or an airway obstruction. Remove your lips and watch the chest fall as the patient exhales. Take a fresh breath for the next ventilation. 2 breaths should take no more than 2 to 3 seconds. When those 2 breaths have been delivered, turn to chest compressions immediately without any delay. When using a rescue mask, you must ensure an airtight seal around the entire mask. CPR. Chest compressions should be performed on all patients who are unresponsive and not breathing normally. Kneel beside the patient's chest. Place your hands over the lower half of the sternum. Place the heel of one hand in the center of the patient's chest. Place the heel of your other hand directly on top of the first hand. With straight, locked elbows and your shoulders placed directly over the patient's chest, bend at the waist and use the weight of your upper body to compress the chest. Compress 1/3 of the depth of the chest. The rate of compression is 100 to 120 per minute. For all ages, the ratio of compression to ventilations is 30 to 2, no matter who. After compression, the chest must be allowed to fully recoil. Push hard, push fast, and minimize interruptions to CPR. Defibrillation, AED. The most effective single treatment in the management of cardiac arrest is defibrillation. Yet, only 5% of cardiac arrests involve the use of an AED in the community. In a sudden cardiac arrest, each 1 minute delay in the defibrillation results in a 10% drop in the survival rate. Every minute matters. Immediate CPR and rapid defibrillation are the 2 most effective interventions a surf lifeguard can perform in a cardiac arrest. Attach the AED and follow the voice prompts. AEDs can only work when there is a shockable cardiac rhythm. Continue CPR until the patient recovers and there are obvious signs of life such as breathing. A person with a higher level of training takes over patient care. you are too exhausted to continue, or the scene becomes unsafe. A few extras. Send for help. If you're alone with an adult who is unresponsive and not breathing normally, place them in recovery position. Establish an open airway and then go for help. Airway. If the airway is blocked by semi-solid liquid, such as thick vomit, turn the patient onto their side, scoop out the visible debris, then quickly replace the patient on their back and continue CPR. Minimize any interruptions to CPR. Never force a conscious patient to lie flat on their back. Doing so may compromise their airway or breathing. For any breathing patient, recovery position is preferred. COVID. In the COVID area, direct mouth-to-mouth ventilations are an individual's choice. They need to have carefully considered all risks and the benefits to the patient. Mouth-to-face shield and mouth-to-mask are breathing options that are somewhat safer, but still expose patient and serve lifeguards to the risk of infection. Please take all reasonable steps to keep yourself safe.